All right, so we are live. Welcome to another episode of Mind Health Matter, a place to discuss our mental health as Caribbean people. We are your host, Flavia D'Souza.
And Kimberly Ho-Mishashek.
Welcome again. We have a wonderful guest with us. I think Dr. Kimberly Ho-Mishashek is going to introduce her, and then we'll get started right away.
Yes, today our special guest is Dr. Lovern Moseley, who's a licensed psychologist with over 25 years of experience in the mental health field with children, adolescents, and adults. Currently, she's on the staff in the Division of Child and Adolescent Psychiatry at Boston Medical Center. She's also the site training director for the Boston University School of Medicine Mental Health Counseling Program. Also a clinical assistant professor in the Department of Psychiatry at the Boston University School of Medicine. And also the CEO of Empowerment Counseling and Psychotherapy Center, which is a group private practice with locations in Massachusetts and Rhode Island. So with all this wealth of experience, Dr. Moseley can share with us today her work extensively with parents and children struggling with emotional and behavioral disorders, also those with traumatic exposures, including abuse, neglect, abandonment, and management of issues related to grief and loss. She also specializes in Christian counseling, marriage and family therapy. Also, her work includes work with interracial couples, multiracial individuals, blended families, foster care, adoption, and individuals of Caribbean descent. So she has a whole heap of experience with a whole heap of issues. She also completed her postdoctoral psychology fellowship in the Department of Child and Adolescent Psychiatry at Boston Medical Center and earned her doctorate in counseling psychology at Temple University and her master's in human services psychology at LaSalle University. So we welcome Dr. Moseley today.
Hello.
Let me try to change up this. Yes, this one. Let's do this
one. Thank you so much for having me.
Yes, thanks for being here.
Your story, well, at least your biography, is so impressive. We thank you for coming on, and it's been a stressful period. We had hoped to have you on a couple of weeks ago, and due to an emergency, you weren't able to make it on the show at the time, but now you are here with us, so we thank you for that. So as I was saying,
yes.
Go ahead.
Yes, thank you again for having me. The past few weeks have been a bit stressful. My mother has been ill and is recovering, and so we're grateful for that. She's at home recovering now, and so we're really very grateful that she's back home. So I apologize for not being able to be with you all a few weeks ago, but I'm so glad to be here today.
So your bio is very impressive. And one of the things that we like to do on the show is just to get to know our speakers a little bit. All of them have Caribbean or coming from a Caribbean background. And so we wanted to just start about hearing a little bit about your journey to the United States and how that was for you.
Well, I was born in the Bahamas to Jamaican parents, very long Jamaican lineage. It just so happens that my family migrated from Jamaica to the Bahamas back in the 60s. And so my grandfather, Canute Moseley, was from Negril. My grandmother, Iselin Moseley, was, from Highgate. My parents, my father was, Rudolph Sr. was born in Mandeville, and my mother, Patricia, in Kingston. My maternal grandmother also in Kingston, and same with my maternal grandfather. So, it's this mishmash of the Bahamas and Jamaica. But when I was about 2 years old, my father went to work on a cruise ship It was with the Royal Caribbean Cruise Lines. And so that afforded me the opportunity to live between the Bahamas and Florida, actually, because of the work that he was doing. My mom wanted to make sure that, we still had contact with our father, at least seeing him once a week. So when the ship would dock in Florida, we were living in Florida. When the ship would dock in Bahamas, we were living in the Bahamas. That also resulted in, a lot of moves as a young child, during my elementary school years, up until 6th grade. And so I graduated from 6th grade in Florida, and then we settled finally back in Nassau. We started 7th grade and stayed through graduation. So there was a lot of familiarity with the United States, even at a very young age. And my parents did travel a lot, and so we had a lot of exposure. My grandparents traveled a lot as well, and so it wasn't something that was so unusual to make that transition from the Caribbean to the States. So when college rolled around, there was this plan. At least my initial plan was that I would have gone to. I didn't really want to be in the States for college, and it just so happened that I landed in Nebraska at Nebraska in the middle of America, in that heartland of America.
In the cold.
There because we had neighbors in the cold. The first time I saw snow, in October of what was that, 1989. Landed there at 17 in Nebraska. My parents loved cornfields and cows and pigs, so they were in love with Nebraska. But our neighbors in the Bahamas were from Jamaica, and their kids were going to this college, this small Christian college in Seventh-day Adventist college in the middle of the United States. And so they suggested, hey, why not have Lovern apply? And so that is how I arrived there, naive, knowing nothing, and arrived there. And so that was already an interesting experience. But I would say that the time in the Bahamas, even from the school I graduated from, afforded me the opportunity to be exposed to a lot of different people, and there wasn't any fear making that transition, even though it was in the middle of the United States. Even in terms of everything that we've experienced racially, in this country and historically in this country as people of color, I think that there was a bit of naivete going into that, and perhaps that was a bit of a protective factor for me. But I was there and thrived, and I think that even being there, I learned a lot about pushing through adversity. I don't feel that I was necessarily as impacted by the suggestions that I couldn't be a doctor when they were told to me as an undergrad in Nebraska. I had started out with interest in mental health, and from the time that I was pretty young. And once I got there, it was very interesting to hear that there was some, hesitancy or resistance on the part of some of my professors at school, about my ability to be able to move forward. So that was a, very interesting time, but I wasn't to be deterred.
Yes, I'm so glad that did not deter you. And, as we've all heard from your bio, how many, impressive things you've accomplished since. So thank you for sharing with us the many migration points in your life. And Can you share with us a little bit if you think some of this influence of moving many times, transitioning from the islands to the States, influenced your work to enter the mental health field? Or if not, just tell us what inspired your work in the mental health field.
I think that my journey to this work in mental health started at a very young age, while I was in school. And I, tell the story often of, being 14 years old and realizing that this was my calling and this is what I needed to do. And I commend one of my school guidance counselors, who, at the school that I was at the time, who did, a psych inventory, and the maybe it was the strong interest inventory, probably, back then in high school. And the interests that came up were around mental health, were around pastoring, were around counseling and medicine and all of that. And so there was this spark that was started at that time, and I was kind of I would say like the mother of my group, of friends. So if anyone was wondering about anything or anyone, wanted some advice, they came to Lovern. And so it just felt like something natural. What I love and appreciate about my family in particular, within the Bahamas, our family is pretty well known. My grandmother was always very well connected, Lovern Moseley, very well connected. And when I would talk with her about my interests, she was able to get me connected with social services in the Bahamas. And I was able to start volunteering at a young age at the hospital within social services. And that kind of helped to shape the rest of my experience and my exposure. And so there were, all of these, these points of where someone took an interest and someone followed through. And I'm forever grateful. So I think back to my, the high school guidance counselor, Mrs. Martlew, who, unfortunately recently passed. And, and I will continue to remember her, as someone who, helped to guide, as well as my grandmother and my parents. My parents had so many books. And so we actually had like an occupations handbook. Like, who has that? Who has something like that? But my father would have all these books, and I don't know where they came from. And I remember looking up psychiatry because I would only hear about psychiatry. And so my path was looking at, the psychiatry piece and then saying that, okay, this is the path that I needed to go. And so at the time when I started college, I was pre-med and biology. And once I was there, I realized the difference, and I said, okay, it's that school that I need to go to. That's the path that I need to take, not necessarily med school. But I got all the way to organic chemistry and said, okay, that's it for me. I'll make this, this transition over to, to grad school ecology. And, I had a lot of great professors, through my, my undergrad career at another college, because my school was pretty small. I, had to take some classes at another university, and that's where a lot of that exposure in mental health also came from. So it was a long, and I think I prepared my mind pretty early on that, this was going to, take some time, for me to gain this experience and be able to do this work.
Mm-hmm. So it sounds to me like you were nurtured from a very early age. You were supported, and your earliest impressions of mental health work were positive.
Yes, absolutely. And so it caused me to also think differently about the things that I was seeing, even in my own family. And there was always like this curiosity to understand, why might this be happening? Why might that be happening? Why might a person respond in a certain way? And so I always looked at things from more of a holistic point of view. It was never just a cut and dried. And so I think that, just that view also influenced the way that I even work and operate today, that there's never just one story, and that, families, are made up of, a very intricate tapestry. That it's not just everyone all on one path. There's, there's good, there's bad, there's complicated, and we have to be able to embrace and look at all and understand, why things may be going in the direction that they're going. And so I'm grateful that, I had that nurturing and that opportunity to come at it from perspective, and that having that perspective has significantly influenced the, the kind of work that I do today.
What is so wonderful about the way that you're framing it is that working in mental health means that we have a curiosity about stories, and we want to make sense of the stories. And that's such a wonderful perspective. Instead of thinking about it as pathology or something that's bad or something that's wrong, really understanding what's behind how it is that we're thinking, behaving, and feeling, and making sense of that, and maybe making some changes so that we can live the kind of lives that we want to live. You snagged me when you said that you came to the States, and you came with some amount of naivety, so you were protected in early life, and in your earliest, well, maybe it wasn't the earliest part of college, but at some point in your higher education, you were faced for the first time with individuals who may have doubted your, I don't know what it might have been, maybe abilities to pursue a career in mental health, whether it was medicine or otherwise. And I'm wondering, how did you overcome that?
As I examined it and thought about it, and probably later in life tried to make sense of it, I think that my upbringing, within the Bahamas, the upbringing with my parents, the support that I had from my parents and the rest of my family about, this is the path that you say you're on. We're going to support you on that path. It was something that was really extremely helpful. They spoke life into me and into my ability. And I think that what caused me to be deterred was also able to grow in a country where I saw individuals who looked like me being able to excel, and who had positions of power, and who were doing great things. And there wasn't this feeling of being less than or being unable to. We were always pushed. And so I didn't go into things thinking that, this was an impossibility, right? So even if there was a struggle, I was very grateful that, my parents, especially even my mom, would always say, there's always a plan B, there's always another option. So if you're having a struggle, what's another way around it so that you can achieve the goal that you have set out to achieve? Right. So there wasn't, it's like, this is what you said you're going to do. They were really very firm, and making sure that happened. So if I felt that there was a bit of a struggle, I was willing to look at, where do I need help? Who do I need to talk to get the support that I need to be able to move past this obstacle. Right. But I never went into anything with any doubt. I knew this was my path. I had planned it out from the time that I was very young, and nothing was going to deter me. So the way that it didn't make sense to me when I was hearing that doubt. And because it didn't make sense to me, I didn't absorb it. I didn't take it on. Right? I didn't allow myself to sit and reflect on that in a negative way.
Yes.
I knew what my path was. Yes.
I remember you said it was sort of a calling for you, right? It was a calling, and that's something Dr. D'Souza and I also talked about in our last episode too. It felt like we were called to this field, hearkening a sort of, spiritual, sort of religious Christian dimension to our work. And I see that you are, a Christian. You specialize in Christian mental health as well. Do you want to share with us a little bit about your decision to also incorporate that perspective in your work?
Yes. So growing up, I come from a Christian family, a Christian home, where, we attended church regularly, or even if we weren't attending as kids, we were attending. And I found that there was always this drive that I had to want to know more about God, to know more about religion, to know more about this Christian experience. And it was something that was just so strong. Even growing, I would find myself wanting to sit and spend time reading the Bible and understanding. And so when I also, started learning about things in terms of psychology, I said, this fits with what my view is of how even God sees us, in this world, and how we are to think as human beings in this world. And so I've always felt that this work that I'm doing is my ministry. And I take it very seriously. I pray for my patients.
Wow.
I want them to be well, and I pray with my patients. I always said that I'm a pretty unorthodox kind of clinician. I'm not I'm very transparent with the patients that I see. And, maybe some of them may know a little bit too much about me, but I want to show the human side, that we are fallible. We're not perfect. Each time that I go in any work that I'm doing, I say that I'm not the expert. I don't want to come in as the expert. You are the expert. But I also want to be able to incorporate that strength of faith, especially if someone is coming into the office with that, with that already as a backbone, or even if it feels that it's broken, that we can help to build each other up and utilize that as a strength in order to move through the struggles that they're experiencing. And so it's so powerful on so many levels. And even for those patients that I see who may not have some kind of faith base, there are pieces of that also, I'm able to incorporate and bring in, and it makes sense to them, right? There's something that we're called to, and when I'm in session and I feel that I may feel that I'm at a loss, when I surrender myself to God in terms of, this life that's in front of me, then the answer that they need comes. So that's how I know that I'm on the right path in the work I do. And I see everyone, and I treat everyone with equal respect and dignity, as a child of God coming into my space. I look at the individuals who are coming in as precious, as that they're coming in with a need, and I want to be able to help facilitate what it is that they're trying to gain. And I know that in terms of my relationship with God, it allows me to be able to manage that, in a healthy way, in a safe way. A lot of times people say to me, "How are you able to do this work? I wouldn't be able to do this work." And honestly, I can't say that I know how I'm able to do this work either, and so that's when I'm able to sit back and say it's only by the grace of God that I'm able to actually do this, because there are some very, tragic and traumatic stories that I hear on a daily basis, and people are really struggling, and people are really hurting in so many areas. And, and so I count it a privilege to be able to have these lives for me as I try to help them transform themselves. Even, the tagline or motto for my private practice is empowering you to be who you were designed to be, who you were destined to be. And I take that very seriously. I want people, to be energized and renewed, and know that yes, there truly is a different life that they can be experiencing, even in the midst of the struggles that they're facing, right at the moment.
Hmm. So it's so wonderful to hear that you take your work so seriously. There are many individuals, if they're in crisis, or even if they're not in crisis, they're afraid to seek help for many different reasons. And so just to
Mhm.
hear the kind of care that you are offering to individuals who come in is so wonderful and refreshing. We're going to have you back again in 2 weeks' time to talk more about specifically trauma. And I wanted to give our viewers a preview of the kinds of issues that you tackle in your practice, maybe where people might be able to find you if they were interested in looking you up, as well as maybe a little bit about why we're thinking about talking about trauma. I know I stacked those three questions, but
Yes, yes. So my private practice is in I have one location in Stoughton, Massachusetts, and so that's the I'm licensed in Massachusetts, and so that's where I primarily see patients in private practice. I have other clinicians that also work alongside me, who and some of whom are also Christian counselors, and I also have a clinician in Providence, Rhode Island, where there are clinicians there available to see anyone who is looking for service. So the name of the practice is Empowerment Counseling and Psychotherapy Center. And I'm also, as you had mentioned, for child and adolescent psychiatry department at Boston Medical Center. And so I treat individuals across the lifespan. So, there's sometimes I have 3-year-olds in my office all the way up to individuals who are elderly. And I feel that because of the working a lot with families or working a lot with children, you get to see a whole lot more than if you're just on the adult side. And so that's those are the places that I am. I have done a lot of work with trauma, sexual trauma, um, uh, physical abuse, also work with natural disasters. And so this is something that's also a little bit newer to me. I did do some work with the National Child Traumatic Stress Network, around natural disasters and tornadoes and hurricanes and things like that, and some uh, work that they were doing in creating training materials. But more recently, with Hurricane Dorian in the Bahamas, I've been able to partner with the Bahamas Psychological Association around the work that they're doing in that regard. And even as part of my work with them, I've also been able to provide some support even around what we're experiencing with COVID now. And so I've been able to do some webinars with them on telemental health, as well as on resilience and stress management for medical professionals, because it's taken such a toll on on this. I would say the work spans the gamut. Right now, I think just collectively, as as the world, we're going through a very significant trauma right
yes.
now, and
Yes.
yes, with COVID and the amount of death that's been experienced and
Mhm.
loss that's been experienced, and so there's a lot of work. There's a lot of work that still needs to be done, and
Mhm.
I also do a lot of trauma work around loss, pregnancy loss, and
Wow.
yes, yes. So that's also an area that's really very very significant for a lot of individuals.
Mhm.
So
Mhm.
yes, so there are many different areas, and we can talk about that the next time
Definitely.
that we connect.
Definitely. We're really looking forward to this. Trauma is really a topic that's on people's minds and in conversation. And so it'd be really good to give some language around trauma, what it looks like when people
Hmm.
present with trauma, what kinds of things are affecting us, and maybe how to deal with that. And you span the gamut of what it is that we're dealing with COVID, but also the trauma that comes with disasters,
Yes.
both here and in the Caribbean where we are from. And so we thank you again for coming and joining us today. We wanted to wrap up our time today, um, just to say thanks for joining us for another Mind Health Matter. As you all know who are watching, we are on every first and third Wednesday at 7:30 p.m. Eastern Time, live on Facebook and YouTube on Island Fever FM radio station. You can tell us what you want to hear about on the show by leaving comments below or by messaging us on Twitter. My Twitter handle is at Dr. Flavia D'Souza.
And mine's at Dr. Homi Shashik. And until next time, please remember that your mind health matters.
Thank you all for joining us. Take care.